In the past, physicians would use smell to inform their diagnoses. They would smell your breath, they would smell your urine, they may even taste your earwax. Now, I'm sure the doctors are glad that we don't do this anymore. But just because we don't do this doesn't actually mean that it's not such a bad idea. So, dogs have been trained in a laboratory setting to smell using the patient's breath whether or not the patient has bladder cancer. So are we able to use smell in a clinical setting to diagnose disease? Well, evidently yes. Looking at the dog, they can do this with surprisingly high accuracy. But using a dog to do this may not actually be the best thing to do. It'd be hugely expensive to train them all, and not very precise. So, our answer to this, in the engineering department, is to look at a machine called the electronic nose, which is able to smell any substance you like, and produce an electronic smell signature, somehow characterising the smell of that substance. This machine was originally developed to smell out explosives and is used in airports. But it's just starting to come into a clinical setting where it's to perform the job of the physician, in that it's going to produce diagnoses based off of smell. But to actually produce such a diagnosis, a decision, the electronic nose needs an electronic brain. And this is where my own research comes in. So we have been working with a hospital in Coventry and have collected the smell signatures of many patients with lots of different diseases. And if we get some new patient, we're able to smell their breath, their urine, compare it to the smells that we have, and if it turns out that this patient's breath smells a lot like the breath of lots of patients with bladder cancer, we may wish to test this new patient for bladder cancer. And it's in my own research to figure out how to make this decision as accurately as possible. So my personal belief is that such a machine like this will exist in a hospital setting in the future. It has huge potential to do work for a mass screening of diseases. So this thing can perform diagnostic tests extremely rapidly. It only takes a few seconds to smell and process the smell. Extremely cheaply. The machine's quite expensive but almost free to run. And importantly, it's non-invasive, so we don't have to do things like blood tests. And this thing can test for basically as many diseases as you have collected data for. And such a mass testing will be hugely relevant for things like the early detection of cancer. Thank you very much for listening.